Will my vision be corrected forever with RLE or cataract surgery? Yes. And I'll tell you where the answer would be no. So for healthy eyes and eyes that are, older than 25 years of age, the eye is pretty stable in terms of the shape of the cornea and the length of the eye. Neither of those things are expected to change significantly over the course of your life. Now, the only thing inside the eye that's changing is the lens. The lens will change as we age. It'll lose its flexibility first, then it'll start to harden, discolor, and change in shape. And so that results in, ever-changing prescriptions in your glasses until you have cataract surgery. But the general thought is that once we've replaced the lens inside your eye, the changes stop. So if you were satisfied with the result, that's what you're going to get for the rest of your life. Now, the two scenarios where that may not be true is if the length of your eye was not stable, and we call that pathologic myopia. Generally speaking, it's someone who's really nearsighted, and the eye and the tissues, the wall of the eye are not very firm, and the eye will keep changing, growing longer. It's never usually the other way, but it grows long as you become more nearsighted. So typically there are signs of pathologic myopia. There's a lot of scar tissue in the in the sclera and the retina, and it's somewhat easy to identify. And historically, that patient will, you can see the glasses prescription getting higher as time goes by. Very rare, by the way, pathologic myopia, one in several thousand, but we would generally say that RLE surgery is not or cataract surgery would not, guarantee, we wouldn't make any guarantees that your glasses prescription is stable after these surgeries. The other situation is in a younger patient with keratoconus or some kind of instability in their cornea. These are patients who have thinning corneas and kind of like a water balloon that's thinned out in one end. If you apply a little bit of pressure, it kind of bulges out. So keratoconus is kind of similar. It occurs on the front surface of your eye in the clear part. But generally speaking, at the age of 50 or 60, you've accumulated enough exposure to UV light that it stops that change. So we typically don't expect that your cornea is going to change after the age of 50 or so. But anything is possible. I mean, there are certainly different severities of all of these conditions, but as a general rule of thumb, I think in RLE, and premium cataract surgery, we typically want a healthy eye, and we want to have excluded a lot of these diagnoses. Certainly, you can do the surgery, but we'd have to have a pretty thorough discussion about how these conditions may impact your results, but we would have contingencies for how to address certain things. The enemy of RLE surgery or refractive surgeries in general is the declining health of the eye. So typically, if you have a progressive disease such as macular degeneration, or just very severe intractable dry eye or some other corneal disease, we would say it's probably not a good idea to do any of these vision correcting surgeries, because the results will be unpredictable and they may be short-lived because of the decline of the eye. But progressive diseases are, they're not that prevalent, but they are something we want to screen you for and to thoroughly discuss. Doesn't mean you can't do the surgery. It just means that you have to be aware of your eye, and that while we can switch out a lens or add a lens, it's not going to stop some of these conditions. And that's for sure, that this doing cataract surgery is not going to prevent you from the declining health of your eye due to macular degeneration. They're different. They're very different processes in different parts of the eye. Thank you.